Hey everybody, and welcome back to Keep the Light On. I'm your host, Tegan Boo. I was really struggling with what I wanted to talk about this time, and I honestly had a half a dozen conversations that all looped back around to the same common topic. So I felt like that was my sign that that's what we needed to talk about this week. Advocating for yourself has been a proponent to not only my cancer diagnosis, but I feel like my success, even though I have had a lot of setbacks and I'm still actively fighting cancer. I've had a lot of victories, and I feel like a lot of it is because I don't take no for an answer, and because I'm extremely in tune to my body and I stick up for myself. I have been raised since a very young age to always speak my mind, voice my opinion, obviously in a respectful way. I think I've gotten better at that as I've gotten older. And it's something that I'm teaching my kids too. And I'm learning how difficult it is to raise children who are very opinionated. So bless my parents. But I just feel like we get intimidated by needing to stick up for ourselves, especially when you're seeking out some sort of expert. So when you go to the coffee shop, you expect that they know how to brew your coffee, how to make your latte. When you go to a restaurant, you expect that when you order it off the menu, it's going to be cooked correctly. When you go to a doctor's office, you expect that the staff knows exactly how to treat your symptoms with your history because they're an expert. They've gone to how many years of school and gone through all of the training, and they should know exactly how to take care of you. But we forget one key part. They're human as well. So they don't always have all of the answers. And I think that that's kind of brought me back into a place of not being so bitter and upset that my cancer was misdiagnosed and not diagnosed for a year and a half, because they're human too. And the thought of at that time, a 29-year-old having cancer seemed pretty slim. So I've learned to just try to continually trust my intuition. My mom has given me tons of great advice over the years, and a couple pieces of her advice are things that I continually repeat to myself. One is to trust your gut, and the second one is that the doctors, they work for you. They don't have the job just because. They have a job because they have patients. And so that kind of reminds me, yeah, they're here for me. So I'm supposed to kind of question them. And again, respectfully, but we're supposed to kind of question and push back and wonder, is what they're doing and recommending what's best for me? Because the other issue is we're not all the same. So just because, Joe Schmo over here got treated with this doesn't mean that I'm gonna have the exact same reaction that they did. And it takes a lot of fine tuning and tweaking and things like that to kind of get to a good place. And I think that it's so easy for us to get so nervous to push back and question a doctor or anybody, because who are we to think that we know more than them? We don't have MD behind our names. We're not working at the restaurant where our food was served wrong. We don't have that knowledge that they do. So we feel kind of insecure and insignificant and unable to voice an opinion. And I'm here to tell you that it's okay to feel those feelings, but don't let those feelings rule you. At the end of the day, it's your body and you deserve to speak up for yourself, even if it's something as minor as your coffee wasn't made right. I know that I can talk a big game and act like I speak up for myself all the time, but I can think of a time where I ordered a coffee and it was not good, and I was I'm not being that person today. I can't go up there and tell them this tastes absolutely horrible. I just couldn't do it. But then the next day, I can easily send a message, and question my oncologist on why they're ordering X, Y, and Z drug for me, and are they sure that this is what I'm supposed to be doing and how often I'm supposed to have it. So it's just interesting that we can always kind of find those pockets where we're comfortable pushing boundaries, and then the other ones where we're not. So advocate for yourself. I will kind of touch a little bit on my diagnosis story to kind of just bring this home on why it's so important to listen to your body. I started having symptoms of breast fullness and discomfort back in January and February of 2021. I saw my primary doctor, I saw my OBGYN, I brought this stuff up to them. And, you know, on physical exam, you couldn't feel anything, couldn't see anything. You know, we thought maybe I had injured myself at the gym. I used to go to 9-round kickboxing, and I had done this move on the wrecking ball where you like hold both hands on the wrecking ball and you double knee it. I don't know why I thought I could do that in the first place. And I felt kind of a pull or a tear kind of across my chest. So I was like, well, that's likely, like I injured myself. So I took a couple of months off from the gym. I was taking other supplements to try to help with pain. I was decreasing caffeine because they thought that would help. I did all of these things. And I feel like the pain and discomfort kind of diminished some. It also could be that maybe I wasn't thinking about it as much. And then it kind of came back. And it came back in October of 2021. And at that point, I was 4 weeks pregnant with Fletcher. And so I did an ultrasound and I did a mammogram and was shielded and everything like that. And it didn't show anything. And I was like, maybe I'm just crazy. Like maybe I'm seeking something to be wrong, right? But like deep in my gut, I knew that there was something off. So I continued to bring up the issues. And of course, like as I'm pregnant, like things continue to get worse. So it's easy to then say, oh, well, you're pregnant. So it could be a, clogged milk duct. So I started taking supplements for that. Or it could be just a normal pregnancy symptom. But like deep down, I just knew that something was off. I gave birth to Ledger in June of 2022. And literally right after he was born, my OB is walking out and I'm like, hey, you need to look at this, because at this point in time, I have what feels like a softball sized lump in my breast. I have a purplish, like bruised, like hourglass about this big. And I'm like, something is wrong. And he was like, you literally just had a baby 5 minutes ago. So let's like see you for your follow-up and we're going to discuss it then. I'm like, all right. We go home from the hospital and then I end up going back into the clinic because I have bilateral mastitis, which just means that I had like an infection in the breast. So I had like heat, redness, fever, like it was obvious that I had mastitis. So I had to go in, get antibiotics. I took the antibiotics, for so many days, and then they wanted to see me back. And I saw a nurse practitioner. And she looks at me and she's like, is this what we normally look like? I'm like, that's what I'm saying. Like something is off, something is wrong. Like we need to figure this out. So she pushed for me to get urgent testing. I went in and they saw what they thought was a galactocele. And that just means it's a like milk filled cyst. So they're like, yeah, we'll go in and drain it. You're going to be fine. No big deal. So I schedule, that and go in and they're having issues doing anything with it, and I'm watching them do it and I'm like, yeah, this isn't working. And they're like, well, let's use something different, a little bit bigger, see if we can get it. And I'm like, okay, whatever, like I'm here, let's just do it. Like I want to be able to hold my newborn baby and not be in so much pain whenever he's leaned against me. And they do that and it's also still not working. And so of course I'm extremely defeated and frustrated, and they claim that they got tissue samples. And I remember questioning them, are you sure that you got a tissue sample? Because I watched the tube and I don't really see any tissue in there. And they're like, yeah, we definitely got it. We're going to send it off. And I'm like, you're really sure? Because like we can fire this back up and we can get another sample. And they're like, no, we definitely got it. It's good. Well, that sample came back benign. So clearly we didn't get a good tissue sample. Because they weren't able to do anything, I then was told that I would need a surgeon consult. At this point, I'm like, you guys got to do something ASAP, because this is ridiculous that I'm still in pain. I still don't have answers. Like, I'm frustrated. I need help. So I get set up to go see a surgeon, and then I get told that he's out sick, and they try to postpone me another month. And I'm like, absolutely not. Like, as soon as he's back on the clinic, I need to be seen. I'm not waiting another month. And I kept pushing them, and I felt bad for doing it. But then at the same point, I didn't, because I'm like, I've had this issue for a year and a half. It's time to get some answers. So I go in for surgery on July 22nd of 22 for what we thought was just going to be a lumpectomy to remove whatever this little mass is. I wake up from surgery with a drain and all of these things. Like Hayden told me my surgery was way longer than they expected. And I'm, of course, like confused at this point. I'm like, we went in for one thing and like clearly nothing went according to plan. So what happened? I'm questioning the nurses. I'm trying to find out what's going on. And eventually they were like, you know what? We're just going to go get the surgeon and have him come talk to you. And thankfully he did. And I was so appreciative. And he said that he went in there and I bled like a little old lady on blood thinners, that they couldn't stop the bleeding. It took like 7 different things to get the bleeding to stop, which is why I had the drain. You know, they were going to send things off to pathology, but it just was a different beast. It was like a hematoma, which just means it's kind of like blood filled, like a, you know, under the skin bruise. And so he was like, let's see you back in the clinic in a couple of days and let's go from there. So I go back for my appointment on July 25th of 22. I get the drain pulled. He says everything looks great. We don't have pathology back, but he's sure I'm going to have it back, you know, soon. And it's definitely going to be benign and I'm going to be good. I leave the office. And maybe 2 hours later, the surgeon calls me himself and tells me that I have a very rare and aggressive cancer called angiosarcoma. And I'm going to have to be extremely aggressive if I want to beat it. And he was very sorry. And I remember telling him umpteen times that I have 2 small children and literally like a 6-week-old baby. And like, they're going to have to figure it out because they need me. So I have to be here. So what are we going to do about it? I was extremely thankful that they put a rush on everything and I was able to get in with Highlands so quickly and start chemo quickly. I had anaphylaxis my first time of chemo. So that got, you know, then delayed a week. After that treatment, I was able to get with Dr. Ravi at MD Anderson and start my journey with them, as well as have Highlands, you know, coinciding with them and working together. And I'm just extremely thankful for that. But it took a lot of like me just knowing deep in my gut something was off. And it's because I know my body better than anyone else does. And I'm so incredibly thankful that I continue to push and fight to get a diagnosis. You know, I sometimes go back and forth with the timing of everything, right? You know, if I was diagnosed earlier when I first had symptoms and it was probably a really tiny tumor, would I still be on treatment 2 years later almost? Would I have needed all of this chemo and the immune therapy now and radiation and surgery? Would I have needed this abundance of treatment options? And then I look at my son and I realize that the timing was so I could have him. And I'm so, so grateful to have him. Because with all of the junk and all of the toxic things that have been put in my body, I don't know that I would ever have been able to have another baby. And I know that God's timing was the right timing. And I am still fighting the good fight and will continue to fight the good fight and continue to advocate for myself. And it's crazy that as patients, we have to fight so hard. And it's not because the doctors don't want to take good care of us or the doctors aren't listening to us. It's simply like, we're all different and the doctors are human. Like they don't know everything, and we wish they did. It would sure be easy. I mean, I remember I've asked my oncologist like a million times, like, how much time I have? And he's like, Tegan, you know better. Like you literally know I can't answer that question. And I'm like, but can you just like guesstimate? Can you make an exception for me? Like we seek out counsel, and it's important to have trusted allies and people to lean on and to go to and experts to seek out. But know that it is your right to always ask questions. Even if you get the attitude back and the eye roll and this, that, or the other, who cares? Because at the end of the day, it's your life and you're the one that has to lay your head on your pillow at night and know that you have done everything possible for you and your family and all of the things. So this was kind of a heavier episode, and there's lots more things to dive into here, and we definitely will. I wish I could tell you that I haven't been advocating for myself since diagnosis, and that would be a lie. I honestly am the reason that I got a brain MRI in March and found that my skull mass had doubled which then led to a biopsy that was inconclusive, which then led to a CT scan and a bone marrow full body MRI, which showed that I lit up a little bit like a Christmas tree with bone mets. Would I have lit up if I would have just continued doing the immune therapy and gotten scans in 3 months? I don't know. But I'm extremely grateful that I continue to push them and I got the extra imaging and I'm back on chemo, because at the end of the day, I want to fight as hard and as long as possible. And it's also showing my team and everyone else that we aren't cookie cutter, and maybe there needs to be adjustments made to the protocols here. And I want my journey to be used for good. I want my journey to help educate and advocate for other people. So, all in all, advocate for yourself, question things, make sure at the end of the day you're happy with how your day has gone, and always look through your day and find your blessings, find those pieces of light, because you've got to keep the light on.